think it says. Okay, I am going to go ahead and get started. Good morning, everyone. My name is Sarah, and we welcome you to this webinar on mental health. I'm the founder and CEO of People Architectural Group. We are an HR consulting organization. Whether you are watching this live or you are part of this conversation, this is absolutely a very important conversation to have. Every organization around the country find this conversation very important. This conversation, my organization is all about building culture. And then this is a topic that we are extremely interested in. It's about how we create a workplace where people feel seen, supported, and empowered to bring their best self to work. Research have proven that when employees are well, organizations thrive, and that's a partnership we can all be behind. To have this conversation, we have 3 guests that are going to join us in this conversation. But before we start, I want to kind of tell a little bit about my organization. People Architectural Group is a human resources consulting firm dedicated to helping organizations build healthy, people-centered workplace. We provide recruiting, training, and HR solutions that strengthen culture and retention. At the core of the work we do is one belief that when people feel supported, organizations succeed. That's why today's topic on mental health and well-being is not just a discussion for us. It's part of our mission to help companies create an environment where employees can thrive and contribute at their highest level. With this, I'm excited these are the services that my organization provides. And if there's any need, we would love to support you, whether it is recruiting, payroll, training and development, talent development, and HR consultants. To have this conversation today, we have 3 experts who will help us with this conversation. The first is Brian Stuber, who will be our first guest to speak. He is a health and benefit relationship manager at Mercer, with over 15 years of experience as a licensed health and benefit broker and HR broker. He partners with organizations to design a strategic benefit program that enhance employee well-being, improve engagement, and support long-term business goals. Known for his insight into market trends and regulatory changes, Brian helps employers navigate the evolving landscape of healthcare and cost management. He holds a bachelor's degree in economics from Northeastern Illinois University and is passionate about creating meaningful people-centered benefit strategies. And then we also have Dr. Carlotta. Dr. Carlotta Roman is the founder and senior business psychologist of Collective Career Consultant, where she helps organizations build inclusive health and equitable workplace, a certified proxy change management practitioner and an executive coach. She partners with leaders and HR professionals to enhance workplace well-being, diversity, and organizational development. Dr. Roman served as board chair of the Lake County Workforce Development Board and adjunct faculty at the Chicago School of Professional Psychology. And our third speaker today is Dr. Jean Robinson Alexis. Dr. Alexis is a chiropractic physician at Lex for Health. He has his bachelor's of science from the University of Chicago. And his doctorate of chiropractic degree from Palmer College of Chiropractic. He specializes in helping patients prevent injuries and maintain overall wellness through personalized holistic care. Welcome, everyone. And I would love to hear a little bit, as we are talking, I would love for people on the call to just kind of let us know, how confident are you that your current benefits truly support employee mental health, well-being? If you could just write that in the your answer in the chat, and then Brian, you should be able to project your slide as well.
All right, great. Appreciate the intro there, Sarah. Yeah, again, it's Brian Stuber. I work for Mercer. So there I'm a health and benefits consultant. I'm not sure if everyone is familiar with Mercer. Some people know us for one thing or another. But at the core of it, we're an HR consultant. So whether it be for health and benefits, where we have a full brokerage, we also have financial support through our wealth team, as well as our career team that focuses on specific HR challenges that any organizations might have. Beyond all of that, all the services we offer, we are a global organization, which means we get the perspective of the entire world and to see trends that are starting to occur in other countries across the world that may be adopted here in the US. So what I wanted to go through and share is some of the survey responses that we get through Mercer, through our national survey of employer-sponsored health plans, which is the largest and most comprehensive health and benefits survey in the industry. This survey is actually utilized by a lot of brokers in the industry. They'll purchase it from Mercer and then kind of repackage it as their own, the data that we collect. So it goes far beyond just the kind of simple, are you happy with your health plan? Are you, disengaged? Simple things like that. So we'll get into a little bit of that, what I could share here. Any responses coming through that you saw, Sarah, in the chat on how people feel about their benefits?
No, I didn't see anything.
All right, let me get into this here. You see that?
Yes.
All righty. So kind of the idea about mental health and what we've talked about and thought about is there a problem, right? And I think a lot of people understand, and none of these stats should shock you here, is that mental health is kind of on the back burner a little bit when it comes to benefits. Some of the bigger things that stand out here is the 2%, less than 2% of healthcare budgets are dedicated to mental health. These stats confirm to us for things that we already know, that mental health is not a focus of our overall health and well-being as much as it should be. Because what I'm going to show you in a moment is that, this is a cost center to most employers that they may not be realizing at this moment. So despite the mental health issues are being a blind spot for many, there are certain things that we see on the surface for mental health and some of the issues and what we see at work. What are the symptoms that we may overlook just as maybe like an illness or turnover because someone isn't happy at work? And what do these cost the organization overall? And can you really track what's going on with these changes for employees or the challenges that they're seeing? Sometimes these things are hard to understand and tie back to issues that can be solved by HR organizations overall, because they're not very obvious up front. So sicknesses and absences, disability claims, medical claims, these are all can be associated with mental health. And then, your turnover, errors and mistakes on the job. So if an employee is feeling unwell or mentally unfit to do a job, they might just show up to work anyways. And then that's where errors or accidents can occur. Below the surface, some things that people are dealing with on a day-to-day basis are a number of challenges that they might be dealing with. And it's hard to bring these up at work and understand what they are, but sometimes just the awareness or communication to understand employees of what's going on can get people through these tough times that they may be dealing with. So what does this mean and how is it impacting organizations? So organizations that invest in mental health, are seeing a lot of return on that investment. Because really, what are the risk factors for medical claims? This is one of the stats that stands out to me most, that the number two risk factor for medical claims, according to insurers, are mental health issues. So that means the second most claims that the insurers are getting are due to mental health. So there's a demand there, and are we going to be able to fill that demand? So kind of looking at each one of these columns here is going to have a different implication for each one of the issues that we see. So mental health is a business risk. So HR is saying that the second most severe risk to employees. And what is the impact? So mental health issues such as stress, depression, anxiety, and burnout lead to suboptimal productivity, safety, benefit spend, absenteeism. So really what that is employees are spending time and money of the employer on mental health issues that can be kind of alleviated upfront if they're communicated earlier. What is the impact to the bottom line here? So 1 in 2 HR risk professionals are concerned about productivity loss due to employees maybe not understanding where to go for um, mental health issues they may be having. Are they spending time searching for doctors, spending time, traveling different places? So the network access for an employee can be challenging to navigate, and this results in a loss of productivity and loss of time on work. So you can see 12 billion working days that are lost every single year. This is global, of course. But that cost is about $1 trillion per year of loss in productivity. So employers have the unique opportunity to advance mental health support for their employees and fill these gaps within the traditional healthcare system. So, there is kind of that disconnect of mental health and health benefits, but it should all just be a one because it's still part of the human body, right? So what is going on? Governments are starting to regulate and mandate more mental health support. So again, with our global access and reach, we're able to see trends that are occurring across the world in places like Australia, Mexico, Colombia, and Japan, and South Korea, that are starting to drive more and more mandated benefits for mental health. So the question is, do you want to be kind of the employer that's following the trend or starting to lead the trend? In a lot of cases, you don't want to have to wait for a mandate because employees know when it's mandated. Is it really genuine that the employer is caring about your mental wellness by offering something that's mandated? So these are all kind of those bigger picture issues of what are the results of mental health and what challenges are they causing for organizations. I just want to take a pause there, see if there's any questions or thoughts anybody wanted to share at this point. Not good. We can move on. There's a lot more stats here. I'm kind of a stats guy. If there's anything that stands out, there are many more that go beyond this too. So, mental health is impacting the way employees show up to work. So if they're showing up, they might be stressed, they might have challenges, they might cause accidents, all these different things, or they might not be showing up at all, right? So 8 in 10 employees are at risk of burnout. So it means 80% of the staff is about to feel burned out or have the chance to run into that. And, how do you alleviate some of that stress for an employee? But the good news is kind of the light that I see here, and this is a little bit shocking to me, is that 53% of employees say that their employer is actually doing a good job of offering the right mental wellness for them to get through it. So I think that there is a trend of pushing that up and connecting with employees to understand what that is. So the results kind of are shown with the stats here of where the issues are or where there's a disconnect. Could take a deeper dive into the generational breakdown here, right? Kind of the favorite thing is people try to put a label on different generations, and the stats here kind of show that there are differences, but the most most cases they're pretty close, right? People all have kind of the same challenges and issues that are going on. So the point of this is there's a lot to see here, but the overall theme is that benefits offered by the employers are not always what the employees need. And that's kind of the trend that we'll be going through in a little bit here, but we can dive into these breakdowns a little further here. So, um, you know, are you more likely to stay with your employee due to benefits they receive? So 50%, 56% of Gen Z are saying benefits are a reason why I'm going to stay with an employer. And across the board, it's close to 50% for all generations. So that's about half of your staff is looking at the benefits saying, should I stay with this organization based off the benefits that I'm offering or have access to today? Um, More likely to feel their employee cares about their health and well-being. So what Gen Z is saying here, but 73% of Gen Z is saying that these are table stakes, right? Like mental health and well-being, it should be offered, and that's what I expect from my employer. You know, and that's still the majority of people in all generations are expecting that. More likely to be at risk of burnout due to work factors. So this is a high result from all generations too. Work issues aren't necessarily always the job that you're doing, right? If you're manufacturing or building something or building a widget, like you might like that. You might get the stress from having a deadline to create something or build something or present something, but those stresses might be positive for you in your life. Sometimes the work stresses don't come directly from the actual work you're doing, but they can come from things like toxic leaders or toxic coworkers that could leave you stressed while you're showing up to work. And then more likely to feel comfortable seeking mental health support with their managers or colleagues. So again, Gen Z is leading the way with feeling comfortable about speaking their mind about how they're feeling. But again, nothing out of the ordinary or nothing that stands off the page here of saying, hey, there's a big disconnect through different generations. So everyone's kind of on the same page of what they're expecting for their mental health and well-being. Now, a little bit of a busier page here. So according to employees, some of the most helpful mental health benefits are not covered by their employers. So I'll start on the kind of the left side of the screen here. And you'll see that the employee's desire is generally higher than the employer provided benefits. So we're looking at an aggregate here. So 30% of organizations are offering a training to recognize and address my own and others' mental health challenges, while 42% of employees are expecting or demanding this. So that means that there is a disconnect. About 12% of employees that are expecting something like this, their employer is probably not offering something to cover that. And then you can see it's kind of a trend through all these different issues or challenges or wishes that they might have for their benefits of the disconnect there. As we break it down by generation, you can see that 46, 48, and 42% of Gen Z, Millennial, and Gen X are looking for targeted services for children, teenagers, and parents to assist mental health, which can be explained by this group of generational folks having children in the home and looking for that. But you can see as you go down, their demand for these different types of support go down a little bit. There's a lot to see here on the screen to break down. Any questions or thoughts here?
My question is, as you are helping organizations with their benefit selection, are you seeing that some employers are not selecting mental health benefit putting it as a priority?
So in a lot of cases, it's there. The challenge is partially communication and then partial learning how to access it. So it's more just the perception of a lot of employees of what they're getting versus reality. And in a lot of cases, there is just the minimum offered that employers are putting out there. So you have an EAP because it's mandated. So you have it there, but it's not very well communicated. Like everybody knows their deductibles or their co-pays for different things. But not everyone knows where to go when you have, when you're having a mental health challenge, right? That's something that's going to have to be researched. Those aren't communicated up front when you're looking at benefits. You'll see different instances from the carriers that'll give you examples when you see your benefits plan. It'll say, you know, uh, a woman is pregnant and going to have a baby, and then they give out the cost of that, what that's going to look like for that employee. So what's the copay? What is the in-hospital stay? What are all these things for when you're having a child, which is a very important, big milestone in life. And you want to know what the medical coverage is for that. But there's never examples or instances of mental health challenges that could put out there. So it's more just kind of this communication and acknowledgement that's an issue out there, and there's a high demand for it too. So further along here, I'll show just some different ideas that can come up to help communicate and give the perception to the employees that there is help out there for you. Does that help answer, Sarah?
We have a comment that says not easy to navigate or understand between EAP and the health plan access, which is
Sure.
truly, that's true. I've seen this. And I think one of the things that people in my profession, the HR, need to understand is that as we are doing open enrollment or doing employee enrolling people into the plan and onboarding employees, we need to put an emphasis on the importance of EAP and all of that, just like we do for the dental plan. And we spend time talking about the dental plan, there's time about the health plan and so on in detail. So maybe we need to put a highlight the importance of the EAP and the other services too. So it's not, the EAP doesn't just provide the mental health, but there's so much more.
Sure.
There's so much more in that too.
Yeah, it's communicating it. It's meeting the employees where they are, right? If they like a phone call, or if they like research on their own, if they like a mobile app, there's different ways to get this information to people. And it's kind of meeting them where they are, is an important part of this. So there's a lot of ways to figure out what are the best ways of communicating with each organization, because everyone's a little bit different. But having overwhelming amounts of communication can seem over the top, but in a lot of cases, it's just a little trickle of information that can help employees, because you communicated at open enrollment, and then 6 months later, something happens, and then you're like, I don't remember that conversation. These are things that have to kind of trickle out as time goes on. It's not just a one time, here's the information, good luck, have fun, figure it out. So kind of going along with the theme of what we're talking about, how do we address the full care here? So starting the conversation up front. So, like we said, for open enrollment, that's a good place to start. The resilience of general well-being support, specific focus on mindfulness and resilience. So just this continuous support there, communication, information being put out to employees to understand where they can go. Early intervention, right? Those EAPs we talked about, how are they going to access it? How are they going to get maybe digital support for certain things like this? There's a high demand for just kind of like, hey, I'm at home, I'm working from home. It'd be nice to pick up the phone and chat with someone. So there are solutions like that out there. Provider treatment or provide treatment. This is generally where you're going to go for that health and benefits plan, where you're going to say, all right, I need to go to the hospital, I need to go see a doctor. This is what's generally covered. But there's a lot more to it too, right? There's that early communication. There's the evolution of, as time goes on, making sure that it's still communicated, intervening when needed, getting yourself into some treatment, and then recovery too, right? There's a lot of recovery when it happens. You break an arm or hurt a leg or get a knee replacement. There's a lot of recovery. There's a lot of physical therapy for that. Is there recovery for mental health challenges, or is there a traumatic experience that happened, and is there recovery for that too? So beyond this, there's special populations out there. People are different, right? So you got to have specific plans and solutions for specific people, and then crisis intervention. for, workplace challenges that might be there for HR. So this is kind of that ongoing, constant access to mental health solutions that are out there. So beyond the obvious benefits offered, and employees know that most employers are offering what is mandated, but mental well-being is built by fostering a safe workplace. Most employees are not always stressed about their actual job, like I talked about before, but more often their workplace can bring stresses like toxic leadership and coworkers that bring challenges. So it's not just like hey, something happened and I need help. It's let's make sure that something doesn't happen, so you don't need to have to get major help. And we can only control what we control in the workplace, but building a culture of, a safe workplace is very important. So things like your ethics, the action, innovation, not waiting for something to be mandated to offer it to employees, but thinking a little bit down the road of what we could be offering as employer to differentiate ourselves. Belonging, making sure everyone's feeling comfortable in the workplace, and then having boundaries too. Be patient with employees, trust employees. These are all real simple, basic things, but there's always been this history of push and pull with employers and employees, right? Employers are pushing employees to do certain things, and sorry, I'm saying employees too much. Employees are pulling, trying to say, I need this, I need that. Employers are pushing back, saying, you don't need this, you don't, so there's kind of this back and forth, but, just creating a good environment could be enough, right? You don't have to pay for an expensive benefit if you guys are all on the same page, working in the same place there.
Okay.
So what are the strategies that we see at Mercer that, give that right environment and give employers the best outcomes to what they're looking for when it comes to mental health and well-being for their staff? So awareness, number one, and making sure it's aware to leadership too. If you put an ROI or a dollar cost figure to this, letting leadership know that, hey, we're losing X amount of days per year due to mental well-being, that might be something that can get their attention to say, okay, we can make a change here. Employee listening too, right? You could see earlier there was a disconnect about the benefits that are offered and what the employees want. So there's employee surveys that can be put out there. We also at Mercer help facilitate employee, focus groups too. So grabbing a couple of groups throughout the year to understand and listen to them, not just having your kind of boilerplate survey or like, are you happy, are you unhappy? Just getting their actual feedback in a safe place. Education and prevention, right? These are things that, you want to get out ahead of for awareness too. And then changing the culture of the organization. So education is a big part of this. Educating the C-suite too, right? So a lot of them are so driven, they're so eye on the prize kind of folks that sometimes maybe they need to take a step back to understand that building the right culture of mental well-being in the workplace is a profitable time effort that employers should be looking for. And then access for employees too, right? So your EAPs that are out there offering more advanced benefit offerings beyond an EAP. So having access to mental health apps that are out there. These are popular, like, talking about the multimodal access, but not just kind of doing the simple like, well, this other organization is doing this, I'm going to do the same thing. Just kind of looking a little further. Ask your broker, like, what else is there for mental health and well-being and wellness plans that might be out there for employees? And then navigation too, right? I think we all know that benefits in general are tough to navigate, but mental health is the even further down the totem pole of benefits navigation too. So just kind of over communicating, it might sound simple, but just over communicating is what I've seen in my history of working with employers and their benefit plans is that I've worked with groups that have, a really kind of rich benefit plan. They pay 100% the employer is doing it, and the employee still is like, benefits could be better, and that just goes to the employer maybe not communicating enough or giving them a total reward statement for them to understand that, yeah, your check amount is this and your benefits are that, but your benefits offering makes up for a lot of what your salary could be or could be deducted from your salary. So
Absolutely.
these are kind of the four key areas to continue the growth for mental health support, um, and just understanding what employees need.
Absolutely. Absolutely. I mean, there are so many different angles that you can take with this. And I think it starts with the employers providing the benefit. And I think once we have the benefit, then there's other things we can do. So let's see, Dr. Roman, let me project for you. Take it away.
All right. Thank you so much, Brian, for laying the groundwork. You had me smiling, you had me nodding my head because it's right on point. And once again, Sarah, thank you for providing this platform because coming out of the pandemic, it put a spotlight on just how important mental health and well-being in the workplace
Mhm.
is and in our daily lives. So when we say mental health, it is the same as physical health, it's the same as your dental health. So we're not talking about a diagnosis, but taking care of your well-being. So you hear those words like mindfulness and psychological safety. All of these are like the daily practices to help us with our mental health. So as I mentioned, I'm a senior business psychologist, and my role is to really study the health of an organization and to help that organization be well. So with that, that also comes understanding wellness. So I'm bringing in clinical mental health counseling as a part of that. So we are right on point with where we are in this space. You can go ahead and go to the next slide. So I'm not going to even really break ground on this because Brian's already done that, but this is just to show you that if it's not looking at employees, we can look at managers and also executives. We're feeling the pain points of our mental health and maybe even a lack of well-being in the workplace. And many of the very sound studies that we're used to looking at, from job satisfaction to retention and et cetera, highlight that mental health and well-being is a big factor. And you can go to the next slide. So all of what has already been laid down for you in Brian's presentation is that business case. So if there's an idea, there's something that you see out in the marketplace that's being done that can help your employees, you have the data to provide that. I would also say that you're going to shape your programs based upon your employee demographics. It's not going to be a one size fit all. So if you are a, startup, or if you're working in an industry where you have more of Gen Z and eventually Gen Alpha, you're going to see mental health programs be a little bit different. It may not be, EAPs that provide just one-to-one counseling. A lot of technology, a lot of that is at play for those generations. So when we focus on our mental health and well-being, we can see that it's linked to strong engagement, retention, and innovation. So it really helps with productivity, and it helps our employees to be resilient. It helps them to be able to adapt, recover, and grow through challenges. So understanding that the workplace is somewhere they care about how I show up, and I won't be penalized for making my mental health a priority because this is a place that shows me that it does that. And overall, the bottom line, it drives performance. So, where do we start? Culture. Organizational culture drives everything. You can have strategies, you can have programs, you can have policies, you can do a town hall. All of that means nothing if the culture is not in place to support what we bring forth. And a part of that culture is that leaders set the tone, managers set the tone of what culture means and what it looks like in our actions. So, first strategy, normalizing mental health conversations. So, if I am sharing for my employee to try this or try that, am I seeing that? The same thing when we talk about work-life balance and don't feel the need to work on the weekends, but if you're texting your employee and you're expecting maybe some feedback, then that now says that it's not really the culture of our organization. So modeling vulnerability and empathy as a leader, it starts with us first. So even though we might be HR, even though we might be an executive, even though we might be a manager, we are an employee first. So how do we take care of our own individual well-being? Kind of saying, how can I pour out from an empty cup? How can I model something that I don't practice? Creating safe spaces for open discussion. And then training managers to look at the early signs of burnout. So as we mentioned in the chat, you can have your EAP come on site, do a lunch and learn, talk about some of the offerings, because the EAP doesn't just cover counseling. I managed EAPs in crisis management and for a year and a half, and a lot of that includes child care, legal advice, a lot of additional things that come with that. And then the next slide just kind of shows an array of some of those things we've already mentioned that you can bring apart to help normalize the conversations within the organization. And for the sake of time, I'll continue to move on. So also, I invite HR to work with managers to look at how job roles are designed. How is the workload designed? Is it realistic in which we are doing work? We are being challenged by the way that we do work in our new environment with technology evolving, artificial intelligence, a volatile environment. How can we redesign and rethink the work that we do? So from automation to leveraging remote work where we can and making change in increments rather than all at once. So one of my things as a certified pro-sci change manager is really helping organizations to not just look at the end goal, but look at how you're bringing your employees along so that it can be sustainable change and individual change. The second strategy, before getting there, these are just some creative ways in which you can help to, you can go to the next slide, to incentivize programs for employees, and also in a way in which employees find value in the way that they do their work. Doesn't always mean in pay. Maybe it's not that, okay, let me have some extra mental health days with vacation days and PTO. It may come in different ways to have employees feel that well-being and that value within the workplace. So our second strategy, the next slide, with building our third and last one. Wait, we went past the second strategy already. Okay, so I'll present, it's missing a gap of a slide.
Okay. Oh,
That's okay. So for the second one, because we already looked at redesign, you can, it's really about auditing your workflows, building maybe some breaks and times throughout those workflows that can help to alleviate, especially if we're talking about employees working in manufacturing. And then last, looking at how do we help employees set that work-life boundary. And then the last one is doing it collectively. This is not something that's just happening to a particular department or a particular team. It's all of us. So how can our employee base share in that meaning and purpose around building a culture of mental health and resiliency? We have a lot of organizations that do affinity groups. So is there one around wellness and mental health? And leveraging ideas from employees and having that integrated into the organizational culture. Also, celebrating our wins, not just the big ones, but the short ones along the way. And also taking some moments from debriefing to moments of gratitude to celebrate just anything in terms of how an employee shows up. And the onus is on the leader to really understand what that value in terms of what does mental health and well-being look like for this particular employee. Because as they go through their life in different seasons, that value and what they need, it changes. And then when we want to make sure that we sustain that, we want to look at how we're measuring. So being able to utilize post surveys and put in some questions around mental health and well-being. Those employees that are exiting our organization, what feedback is there? And then integrating well-being as a continuous improvement in the organization. So just like we have done things around diversity in the past, things around also integrating new technologies, mental health and well-being should be the same. So my question to you is, what is one challenge or change that you can look at and make this month to support your team's well-being?
Love that. Love that. And then we'll wrap it up with Dr. Alexis talking about, go ahead, Dr. Alexis. You might be muted.
Apologies. Can you hear me now?
Yes.
Yes. Just wanted to thank you, Sarah, for setting up this webinar. Dr. Roman, thank you for passing on the baton. My name is Dr. Robinson Alexis. I am a chiropractic physician. I have been practicing for a little bit over 10 years, and my clinic is in the River North neighborhood, downtown Chicago. So because we're going to be focusing on time, one of the key things I would like everyone to understand is what we call the nervous system. Oftentimes, we need to, there's a portion in the nervous system called the autonomic nervous system, all right? And which has two components to it. One being our fight or flight, which a lot of people are familiar with, and one being our rest and digest, all right? Oftentimes, when we find ourselves in a state of stress, our body will do one or two things. If, for example, we're being chased by a tiger, blood rushes to our hands and feet and we try to flee the area. If not, our body would do the next best thing, which is it wants to protect the most important organs, which is our brain and our hearts and lungs. All right. Now, it's important to understand that the nervous system is a feedback loop. So, meaning just like a stressor, right? Whether it be running from a tiger or stress at work, and we can't escape it, will cause our body to naturally go in a position of protection and vice versa. If we find ourselves constantly positioned in a flex, in a confined position, it can also elevate stress. So I just wanted to kind of start off with that to kind of give us a big picture of the importance of limiting stress in the workplace. All right. So three key things we want to talk about. So first of all, keeping retention, because we're going towards the kinetic chain. As I was mentioning before, poor posture, meaning flexed position, looking at a screen, head jotted forward for an extended period of time, can lead to patients having chronic pain and discomfort. All right. Once that starts, it creates a chain effect, as we said before, and we start that negative feedback loop within the body. So what we want to do, or the recommendation that we want to implement, possibly educating our employees by way of maybe annual virtual ergonomic checkups. All right. So this is a low cost way to provide care for your patients. And then we say return on investment is basically focusing on you have less of your employees indicating they need their stress from work due to anxiety or from strained neck and things of that nature. You can go to the next slide, please, sir. All right. So next we thank you so much. Yes, go back if you don't mind.
Here,
Yes, please. Oh, one more. Yes, yes, right here. No, go back one more, sir.
okay.
Thank you so much. So in terms of how can we actually implement simple things to help our employees, one of the number one thing I find when people come to my office, they often come with a complaint, and they typically want me to do something in order to fix the problem. And I always need to find out what is the source, and we try our best to eliminate the stimulus that causes the patient's condition. Now, if we can't eliminate that the stimulus or the cause, we want to limit it as much as we can. So with that being said, most of our employee, if we have a desk job or working from home, we're sitting for an extended period of time. Even if we don't have the best ergonomic setup, mini break or micro break is a great way we can tangibly implement and basically force I would recommend making it mandatory to our employees to take these breaks maybe every 60 to 90 minutes. And it doesn't have to be anything crazy. It can just be simply sitting up, stretching, going to the bathroom, coffee break, drink break. Because again, if we're constantly in a flex position, it can do one or two things. It can create, you can create a position of disruption in kinetic chain, and also stimulate that feedback loop, that negative feedback loop that also indicates stress. All right, we can go to the next slide, please, Sam. So what can we do as leaders to be role model to prevent these stress from occurring? So what I always tell employers, managers, I really like them to lead by example. So, for example, I often tell my patients, I myself cannot tell you one thing and I not try to physically look the part myself. So I think it's important for you, if you are coaching and discussing to your employees the importance of taking these mini or micro break, I encourage you as leaders in your corporation to do the same and do it visibly so your employees can see this. So they don't think there's a threat or feel as if they may be dock or perceive as not doing work. So I strongly recommend that most of the leaders, the managers, be an example to their employees by themselves taking these small breaks, taking these walks around the office for their employees. Thank you, Sarah.
I think this conversation, I think this conversation, we did not even scratch the surface, because there's so much. I feel like each one of you guys could have had 2 hours to talk. And
Right.
I want to make sure that we understand that this is not where it stopped. Brian kind of laid it down for us, kind of opening it up and telling us, one, this is important. You need to make sure that you're having the right plan. You have a plan, first of all, and you need to make sure that you're making it accessible, letting your employees know that is available. Just because you have it doesn't mean that's enough. You need to make sure that it is part of your culture, letting people know that the benefit is there for you to use. And Dr. Carlotta kind of went into a little bit more, letting you know a little bit deeper of how you can utilize those services that Brian helped you set up for your organization. And Dr. Alexis kind of talk about the physical aspect of how mental health can be impacted when those stressors are there. You know, if there's anybody that has questions on the call, please put it in the comment section. But I would love to hear from you, Dr. Roman. how often do you see leaders talking to you about improving the plans or utilizing the plan that somebody like Brian set up within the organization?
Well, those plans are not used until they're needed. So I definitely agree providing a total reward statement to employees so they can really understand the total value they have from being a part of an organization, which really kind of increases that satisfaction and that loyalty. But it kind of sits in the back. And I would say usually what I'm hearing is keeping up a wall because we don't want to infringe upon privacy, HIPAA. So conversations like this and what we've went through really help to see how we can bring that in a normal way in an organization. So oftentimes leaders are talking with me about, well, how can I leverage this without me feeling like I'm trying to be my employees' therapist? You're not trying to be their therapist, but studies show time and time again that a direct manager, the direct supervisor, has the biggest impact on the employee's mental health and their productivity at work. You might have heard people don't leave organizations, they leave leaders.
Yeah, absolutely. As HR, I will encourage all managers to be very careful of how you are not a therapist. You don't have the skill of that. And I encourage you not to try to be that. Yes, you can listen to your employees, but that's why those plans are there for you to direct your employees to the services who can actually help them solve whatever problem that they have, because you don't want to do something that's become a liability for your organization as well.
And can I add just one quick thing? EAPs in some organizations are also used as a requirement when there is some type of issue on the job. So it's built into that maybe performance improvement plan. So EAPs have been utilized around that as well.
Yeah, absolutely. Brian, do you have any last feedback, last comment you want to share before we wrap up?
Yeah, sure. Appreciate it. Kind of what Dr. Carlotta was saying was that, there are benefits and plans that are out there to help, but as a broker, what we're trying to do for organizations is find ways to save money for them. And it's not always kind of trimming down the benefits, but it's getting out ahead of it so that you don't have to wait for them to make a claim, right? If you saw some of the stats there with the insurers are saying that the highest amount of claims that they're getting are due to mental health challenges. So if you could get a little bit ahead of that in advance in communication or building a safe workplace or, having access to professionals that can help you before making a major claim, that's just going to save the organization that much more money.
Absolutely. Absolutely. Dr. Carlotta, any last minute comment?
I was going to say promote the use of the EAP before an insurance claim, because you have like those 3, 6, maybe even 8 sessions that come with that's not paid, and then have employees utilize that. So normalize conversations in mental health. That's really what it is, and then it'll start to grow.
So Dr. Alexis.
Yes, I would just simply say just aim for the low-hanging fruit. It doesn't take a lot to just simply encourage your patients to take these mini breaks. A simple standing up and spreading your wings goes a long way, and it's about the compound effect of these movements.
Absolutely. I know he say patient, but for us, it's employees. So
Excuse me. Yes, my apologies.
that's okay. And for me, I would just encourage my fellow HR leaders who are on this call. We are always good at creating programs for our employees, but sometimes we are the worst at utilizing those services ourselves. And I encourage you to understand that, like Dr. Carlotta said, you are too an employee of the organization. You need to be healthy too. And you need to think about yourself, because when you are healthy, you can help others be healthy. Recognize when you are overwhelmed, recognize when you need a break. And so, because you are modeling, people are watching you, your employees are watching you. And so be mindful of yourself as well as you are leading your organization. This has been such a great conversation. And I think that I just wanted to encourage you to reach out to the EAP, reach out to your broker, talk to them. They can do lunch and learn for you. And so you can talk to them about how can you make this more of a mindful conversation, not just in a month where mental health is, people are talking about mental health, but it should be talking about throughout the year. And so make sure that you are being aware of that. Again, I want to tell everybody that joined us to thank you so much for joining us. I will be sending out a survey. If you're on the call, I would love to hear your feedback. After you watch the video, if you are watching the replay, because I think I have a lot of people who's going to be watching this replay, please fill out the survey and let us know how we can continue to better the conversations that we have here. If you're on the call, I will send you information for your one HRCI and one SHRM credit. The code will be going out to you in the next hour or two. And also, I know that if there's any way that I can help you with your employee employee handbook or any employee related issue services, I would love to be able to talk to you and have a conversation with you and see how we can help you continue to build a thriving workforce. Our next webinar is on November 19th, and we are focusing on workforce planning for 2026. And so I encourage you to be on the call with me. And I know that each of my guests here would love to connect with you on social media. I am going to send you information about their contact information. And so feel free to reach out to them. Each one of them are on LinkedIn. So if you're not connected with them already, please give them a call. We are in employee benefit right now. And I've been talking to Brian about other things, and I know he would love to be able to help you take a look at the plans that you have and see if it is the best. He'll have a conversation with you one way or the other. So, and I know Dr. Roman and Dr. Alexis would love to talk to you as well. So please reach out to them, and they are here as a resource for you. Again, thank you so much for being here with me today. And thank you for being here with us. And we look forward to seeing you in the next webinar.
Thanks, Sarah.
Thank you.
Yes, thank you so much.
Thank you.
All righty. Take care.
Bye-bye. Hold on. I would love to get some feedback from you, but let me see. I have a couple people. Let me see who's here. Okay, go ahead. Hold on, let me get rid of these. Okay, you can talk.
Oh, I mean, I love the setup. I love the flow. I mean, just you are right. Like this could be, you could have this every once a quarter if you wanted to. This type of conversation, especially as like so many things happen externally that spill over internally. I do the same thing, maybe having one person manage your Zoom environment, and then you could just be the main stage, because I do that too. I'm like, okay, where's this? Where's that? But outside of, I mean, it's a conversation. It felt I will commend you on that. It's very conversational. It didn't seem like, I'm at a podium and I'm scripted. I really like this authentic conversation.
Good. As we were talking, I'm like, oh my gosh. I don't know if this year, I did a conference. I don't know if you were aware, I was posting on it on social media, inviting people. And my next one is in May 13th, 2026. I don't know how. I would love for you to be part of it. I don't know how. And I think this is a conversation to have a session, to do something. I'm still working out the details. If you want, I can send you some more information. But I think I was like, oh my gosh, either at the conference or we need to have a lunch and learn here and just let people ask questions and we need to have more people at the table for this.
Yeah. What's the theme of the conference?
My theme is Let It Bloom with Intention.
Okay.
So Let It Bloom with Intention. Let It Bloom is my conference theme. And then every year I will have something else. So last year is just like, we want to grow. This year we want to grow and just like throw whatever in the garden, let it grow. This year, next year, it's like, what is it specifically that you want to grow? You know?
Okay. Is your target audience entrepreneurs? Is it HR business professional?
My audience is the clients that I call into, which is small business owners who are leading organizations, have responsible for the workforce, or HR leaders in HR. So my goal last year, I didn't meet my attendance goal, but everything else was on point. Everything else was great. But again, I'm trying to really get to the HR people in Lake County. When I go to by O'Hare, there's a Wazoo networking event for HR. I go to Schaumburg, there's a bunch of stuff. Up by us, there's hardly anything, but we have so many big businesses that we should be able to have a community up here. And it is my goal to be able to partner with people like yourself who are calling on the same kind of organizations to, there's enough business for all of us, no matter what. So I don't see it as a competition. If you do, then understand.
No. I don't see it as a competition. Even if we were in the same lane, I really see we have a little overlap, but you're definitely HR front office like that, the engine.
Yeah.
Kind of linked like organizational development, but reaching out in terms of management and other spaces. Definitely send me more information about it. I could say a yes for me being present from a mental health and change management, kind of what I talked about today, but also the Lake County Workforce Development Board might be able to present there or something if you needed it, if the organization too.
Absolutely. Last year, what I did was I had a community resource section because of who I called on. Part of my clients are smaller businesses too. We have so many hats. Right now, I'm the CEO. Next time I'm going to be, I'm everything. So I did invite the workforce development to come and be part of that discussion. I had chambers, I had Lake County partners, I had multiple, I had SCORE, I had multiple people out there. We had a discussion, a panel discussion with about 5 different organizations. Provide support. Lake County could not be there because they had their job fair that day.
Okay. I'm like, so why didn't say yes?
Yeah, they did not. And I was like, when I invited Omar, he couldn't be, Jeff couldn't come. I think Antonio just transitioned. Harris, what's Harris' first name?
Jennifer Harris, she's the executive director.
Not Jennifer, but
Jennifer Sereno. Damar Harris.
Damar. I invited, I guess they were really focusing on which I can understand. That's probably at first because they said yes, and then they were like, oh, like I wish I thought about it because somebody from the board should have been,
somebody from the board, could have probably been there. And at this time, we actually have leveraged different chambers to help not just get Lake County out there as a brand, but to engage with businesses. Um, so, because I'm actually doing a fireside chat with Lake Zurich later this month, but yeah, I really you said exactly what I've been talking about more recently about Lake County being dry in terms of HR professionals networking, because I just went on HR hot seat and I was like, let me see what North Shore is doing. It's been 2022 since they did anything, at least what it showed. So I've been thinking we could have some affinity groups, one around HR, one around entrepreneurship, just in terms of letting HR professionals get together and network, because we have some big players at the table with our board. When you think about United Way, and the president of United Way Lake County sits on our board. College of Lake County president sits on our board. So check out the board and just see. I don't, I'm not
This,
recruiting. I'm not recruiting, but if you felt
I want
you
to
have an
be in the board.
interest to be a part of the Lake County Workforce Development Board, there's room. We
Do
can
you
talk.
have an open seat?
I was just talking yesterday with the executive director about us having one or two people they're looking at 4 seats. So it's not like there's a limit. So 51% of our board makeup has to be the business sector. You are the business sector. So if you want, I can go ahead and connect you with our board coordinator just for a conversation.
I would love-
Okay. Yep.
This is one of the things that I'm working on right now. I've already have Mercer, I have Paylocity on board, and BCU might be joining me. We
Okay.
want to create this kind of like, we don't know if it's monthly or quarterly meetings where we are having just what you said. One of it, I joined the economic development of Mundelein, and it's just for the purpose. There are so many resources out there, but you never know they are there because they are not well communicated, and I think somehow we need to figure out, and that's one of the reason why at my conference, I said, no matter what, I'm going to have a community resource conversation or have them there to be able to talk to people, because in 5.5 years that I've started my business, I have found a lot of things by mistake, by error, by chance. It's like, oh, that, oh, that, oh.
Yeah.
If only I was able to find a centralized area or knew that, my gosh, let me go to Lake County. Oh my goodness, let me talk to SCORP. That would have so many sleepless nights. I would have been able to relax, And so I want to be able to do that. And it's just like, I know I'm a business owner. I want to connect with people for potential whatever, but at the core of who I am, I think sharing information, sharing resources, helping others, because when you do that, all of a sudden somebody tell you something that helps you solve a business problem that you can't even put a dollar amount on. You know what I mean? So it's not just, connect to, let me see if I can get a contract. No, it's like, how do I build my network? So to help me solve my problem as I'm helping them solve their problem. And I think that's all I want to do with the networking that we are doing.
Yeah, you would think the SBA would have been that place that an entrepreneur can go to find out all the stuff. I question maybe Lake County Workforce Development should now become that hub, because I know the SBA won't continue at CLC. So having this conversation is sparking that for me, that perspective as an entrepreneur is like, I don't know what I don't know. And then it seems daunting, like, okay, this is a lot.
I have said the same thing to Michael Darling. Have he talked to you guys about, because they need he said they have to have a sponsor host, because CLC is not anymore. It's not going to be as of January or whenever that is. I don't know where that comes from.
It's the grant. Yeah, that's what I'm kind of saying, like it not being there anymore. Okay, maybe with our that's something to think about, because we want to become a leader around workforce development in this space. We want to be a convener. We don't want to be like the being that does everything, but we want to convene everyone together. And entrepreneurship is a space that's untapped, including digital online entrepreneurship, which is something I'm even tapping into. If I remember correctly, didn't you have a passion project, something around philanthropy? I might be thinking about someone else. Was that you?
My
Like,
my family have a 501(c)(3).
I think I remember, and I think I might have was talking about like ministry or something, and you were telling me about ministry.
So we have a ministry in Haiti. My dad was a pastor. He passed away in 2020 due to COVID, and we have 133 churches in Haiti, 17 schools. We have 7 orphanages. We've had some school close as a result of what's happening in Haiti, where gangs have taken over areas. So as a result, our churches and have been impacted, and schools off. We had to move 3 of our orphanages that has cram into others. We centralize kids and stuff like that. But yeah, so we definitely have something. We have our annual banquet coming up in November 15th. But yeah, definitely. I remember you too. I remember connecting with you. I'm like, she's in
Yeah.
PA too. So I remember that.
Yeah. So the Christian counseling is the thing. So, finishing the or about to be a licensed therapist. So it gets into that. So, but I was like, I remember she was talking about some ministry stuff. So we had connected over that.
What I don't share with people is that my business supports the schools in Haiti. When my dad passed away, I took over the schools, and a portion of my profit goes to pay for teacher's salary and so on. So people who work with me don't know that.
Okay.
I don't publicize it all the time because I'm like, okay, this is something God called me to do, and this is what I would do anyway. But it's a portion of when you work with me, you are not just putting it in my pocket, but you are touching lives of people you will never know.
Oh yeah.
This is why I do what I do, because if I didn't have this ministry behind me, I'm telling you, Carlotta, I would have closed this business a long time ago. I feel like I know HR, but running a business is another thing. It's a job in itself that I don't enjoy as much as helping people with their HR issues, I don't hope that doesn't sound bad, but
I'm like, Lord, if I could just live on my volunteering as currency, I would be rich.
I
Be rich
know.
giving.
I know. I would be fine, but like if I sometimes I'm like, okay, do I want to go back to find a job and just take all that headaches of running a business? But I have not been released from my running my business. And when I feel, I always say, Lord, when the time is right, you let me, I will move on. But I have not been released from this charge yet. So for this season, I don't know if it's a forever season, but for this season, my organization needs to keep going. And every time I think, I'm like, I am done. This is so bad. And then God sends something. It's like, okay, I'll give you something right now, so.
I'm glad to hear that fuels what you do. It's your why. It's the passion that keeps going. That inspires me in terms of supporting my why. So yeah, let me connect you with our board coordinator, and however you want to integrate or participate with the workforce board, it is welcome. And yeah, and when you talk about all the networking, are you still in, I think is B
BNI,
BNI? Because I know there was another one, G7.
GLMV, or G7.
G7.
G7. I did not join G7. I was in BNI because it was BNI or G7, but I already joined BNI when I find out about G7.
Okay.
So I just finished. I ran my 2 years with BNI. I'm like, I'm done. But G7 is something that I'm thinking about. But my biggest problem is I'm already part of a CEO group.
Mm-hmm.
That's expensive, and G7 is expensive.
Mm-hmm.
So, and then it's not even, the money is one piece. And then being in making yourself available every week at a specific time, that is a killer as well for me. So I love the concept. I'm
Mhm.
in two CEO groups that I have to be there for 4 hours in person every month. So 8 hours total, and other networking that I'm doing. I just don't know. But I love the concept of G7. We pray together, we work together, we network together. So if I had to go to another one, I probably would sign up for G7 once I get rid of one of my CEO group. But
Yeah.
and yeah, I'm part of so many chamber and so on, and girl, all those things add up.
And that's what it's meant for me. I know somebody else told me about, like, it was like a Black woman's group that one of my friends, I'm like, I do a lot of networking, so I just want to do stuff that's meaningful, not being, I got to be in extra rooms now anyway. So I might join one of those. So maybe I might ask you about your perspective of how it's been again, but I'm gonna wait till next year.
I'm budgeting stuff. There's two that I'm gonna be joining, the Lake Bluff, Lake County Chamber.
Okay.
For what you pay for them, it is good.
Okay.
And the Northbrook Chamber, those
Okay.
two are gold.
Okay.
I've gone to their free thing, and I'm like, for the conversations that I'm having, it's worth more than I pay for the BNI.
Okay.
And I pay $2,000 a year for those, and I'm like, oh my gosh, and you pay $300 to that. That's
Mm-hmm.
worth it. So if you're thinking about something, the Lake Forest one, the Lake Bluff, you don't pay it. They do a breakfast that I go to, and it's only like $30 for the
Mm-hmm.
breakfast a month. But the people in the room, it's the conversation you have, it is definitely worth it. You eating and you're just meeting people. The one for Deerfield is the one. Deerfield, you don't pay anything and you just go, and it's very good conversation. And Northbrook too. So if you want to join me when I go this coming month, I'll send you the date of when the next meeting is if you want to join me. They are early,
Okay.
but worth getting up.
I know right now, so I'm a part of the Lake County one, which their reach could be a little bit better because, as you learn more about the chambers, like it's so many, they don't connect.
Talking about the early morning breakfast, the early morning
Well,
networking.
yeah, well, I'm just a part of Lake County Chamber of Commerce
Yeah,
as a
me too.
member.
Me
So
too.
now I have to get started back again, but the workforce board and the Lake County Workforce Department has an RFP out there in Lake Zurich. And I think maybe the Lake County Chambers, we got like two or three, are receiving funds to do work for us.
Okay.
So I'm going to,
GLMB is, I know for sure.
yeah. So I'm in spaces where already these things are happening. Like the fireside chat is just,
You don't need to pay for that.
yeah, I don't need to pay for that, but I still think, but that's from like the board chair lens. There's still very strategic ones, like how we're doing within the HR space and with small businesses that makes sense. So, yeah. So as those come up, you'll find more out about those, with what comes through for the workforce board. So,
Okay. Well, the first time I met you, we were like, oh my gosh, we need to say to we need to say that. We haven't, so.
we'll have to get together. Well, I mean, I've been off the scene. I'm like, okay, I'm starting this, jump out of a PhD and go back and get a master's degree, whatever. But,
And I'm starting a PhD program in January.
since I went through my PhD and got PTSD, I always push it up on people. But when people tell me they're going, I support them. Because the whole adjunct thing, I'm like, Lord, I don't want to be nobody professor. I want to be out here creating stuff. And then I'm going to come back and give something to the students. So what program are you doing and when you start? Or
I'm starting in January. I'm starting with Concordia University. I'm doing a DBA.
okay.
Yeah, so I wanted to do organize And actually, I have a couple stuff to do to wrap it up completely. But I'm like, no, I changed to HR back then, and I always husband was just being a Black woman, Black immigrant woman in America. Gave me what I needed to survive. So I say every penny that I paid for that program was worth it because it saved me. It saved me. And I had awesome professors who were clinicians themselves, and I can tell some of them is like,
schizophrenia. So I dealt with that at the age of 22, coming right out of college. So, and it's something not as prevalent for her, but it's still there. But that in itself helped me to see myself within her story and how it indirectly impacts you and caregiving. And of course, when DEI, George Floyd magnified everything, I saw that people could not separate what happened externally from what was how they were showing up at work. And that's why I was like, do I go do EOC? No, it's counseling. It needs to be integrated into the way in which I coach and support the culture of an organization. And just that one sentence would be what sums up what I do. I try not to pigeonhole myself into DEI, even though I got it trademarked, inclusive and equitable workplaces. But I don't think that that's going anywhere. It can represent many different things.
I really think that you and I can have opportunity to collaborate a lot this coming year as I'm planning. I'm moving my office downstairs in my building because I want to put a bigger emphasis on training, and I have space. I'm going to have space for training, in-house training next year. So, and we are talking, I'm like, we definitely need to keep talking and see how we can do these things. How can we collaborate and do some meaningful work together? Not just with the workforce, absolutely with the workforce,
Mhm.
but our business together.
Oh, well, just let me know. We'll get together. I know I met someone from like HR Hot Seat or SHRM. Christine Render, she has Scale Up, which is her like training and total rewards HR. And we'll like meet up in like an office space. So I have the Regis office space membership. So we'll just kind of collaborate on some different things. So yes, collaboration is there. Like there's a lot of things happening in HR and mental health. So you're right on spot. So I think that what you're doing is a great idea. And I'll make sure I'm attending the next one on the 19th when we talk about workforce planning.
Yes, absolutely. Well, thank you. Thank you so much for your time. Sorry I kept you longer than expected, but yes, please send me some information about the workforce board. I'll look online as well. And anything that I can do. And I'll send you some information about the conference, and let's stay in touch, please.
Yes, yes, I will be more intentional. Because I'll say sometimes I'll get like all come to the networking group, and I'm like, okay, I will. Let me think about it. But I'm past that now. I just gotta choose which one, and then I can tell people, oh no, I'm a part of this. I can't do that.
Awesome. Well, again, thank you. You have a good evening. Good
You
day.
too. You take care. Bye-bye.